It's Monday, March 4th. I'm Adam Walsh. This is The Signal. Whether it's this province's social systems or its healthcare system, across the board, you will find social workers in essential positions. March is Social Work Month, so today we will speak with social workers across Newfoundland and Labrador about their profession. And I was looking at the website for the College of Social Workers in this province earlier this morning, prepping for the show. And there's a message from the chair, Nadine Calloway. Here's a line about what social workers do, right, to expand on what I just said. And obviously, Nadine will say it a whole lot better than me. Quote, social workers work diligently to provide competent, ethical, inclusive, and high-quality service to advocate for systemic changes across the social determinants of health and pursue truth and reconciliation, unquote. So remember this line through the show, because as we chat with our guests today, you will hear how their work connects to everything that Nadine Calloway said in that line. Coming up in this hour, we are going to hear from social workers in Labrador, the Northern Peninsula, and also here in the Metro region. We begin with folks in studio. Kim Kelly, social worker, welcome back. How you doing?
Hi, Adam. Good afternoon. So happy to be here. And we really are delighted to be able to shine a light on social work, and what we do in the lives of individuals, families, groups, and communities in this province. We are an essential profession, and, other professions sometimes get highlighted a little bit more than us. So we're happy that you're helping to highlight us today.
Oh, look, I'm happy. This is a few times now we've done it. I'm happy. Every year when I get the email, typically late fall, you organize social workers like, hey, we want to book something for March. I'm like, okay. So typically the social work show is the first show I have booked for the next year. So this is it is great to do it. I love it every year. Also here in studio, we've got Jill Peckford, clinical lead of addiction services with NL Health Services in St. John's. How you doing?
Good, thanks. Thanks for having me.
Thanks for coming in. And we've got Bonnie Hobbs as well, Regional Social Work Coordinator of Primary Healthcare and Chronic Disease Prevention and Management with NLHS in St. John's.
Hi, Adam. Thanks for having me.
All right. So, well, thanks for coming in. I always kind of start this way. Why social work? Who to go? I'll go with Jill first.
Ooh, I'm first off the hop today. Great question. Why social work? My story actually kind of starts how I got to social work is from a really strong family history of social workers. So my grandfather was what we called years ago a welfare officer and worked across the province. And then my father actually did some work with the Department of Social Services back in the day as a senior civil servant. And that was kind of in my teenage years. So I got a real introduction to what the breadth and diversity of social services and social work could be. And then I also have an uncle who's a registered social worker. So I have a strong family history. So it just kind of felt like a natural fit. And kind of growing up, I was always more kind of the person people seemed to want to talk to.
Okay, yeah.
And, looking back, as an adult and looking back at that, now I'm like, oh, okay. So, something about that, I guess, led me to the field. And now I'm 25 years in.
25 years
in.
Yeah. What do you think it was at in those earlier years with the family history that, because you talked about it being a natural fit, I should say, but what was it that kind of that you think really was pushing you towards it when you saw the breadth of everything?
I think it was always really kind of a draw towards helping people. Always just wanting to have just a natural curiosity for people, diversity for situations, and just a really willingness to help out in whatever capacity. That was just kind of what really drew me in. Yep.
And 25 years later, how do you feel about it still?
25 years later, I think I'm just as passionate as I was way back in that when I graduated and walked across that stage with my BSW.
I would imagine this is one of those jobs where you have to be kind of continue, the passion has to continue, or perhaps folks shouldn't be in it.
Exactly.
It's because it's so important, right? What do you with that passion with your colleagues and stuff? What do you notice about it? For talking to folks about why is that fire still there for folks? 2.5 decades later.
I think it's because working in whatever situation you're working in, because that's actually the beauty of this profession is that there is such a diversity and such a breadth of practice in different areas, whether it be mental health and addictions, where I am now. Previously, I've worked in child protection. I've worked with children. I've worked with in the area of housing and homelessness for many years. Worked in a criminal justice system as well with adults. So like it's quite a breadth. So I think that really kind of helps keep your interest. And then every individual, every family, every group is unique. So that presents with it a new challenge every time. So that's what keeps the work so interesting.
Bonnie Hobbs, what about yourself?
So when I first started, I actually knew at like age 7 I wanted to be a social worker.
Age 7?
Age 7.
So wait, what were the other kids saying when you were,
I know,
you
right?
sit down in class and
Yeah.
it's like, oh, I want to be a firefighter. I want to be a superhero. I want to be a social worker. So obviously you got good grades in school.
I don't know about that. Yeah, I guess so. But I guess I was introduced to a family friend who was doing social work at Memorial at the time when I was 7, and just really inspired by the conversation that I overheard as a child around, what she was learning and the ability to work with children and families, and just the vast profession in terms of the areas that we can work. So that was at age 7.
Age 7,
Yeah.
wow. Like, as you continued from age 7 upwards to go towards it, like, was there any point where you thought, maybe not for me, or was there anything or was it still every step of the way, like, no, this is great?
Yeah, every step of the way. My high school yearbook, my ambition is to be a social worker.
No way.
Yeah.
Wow.
Yeah. I always wanted to help others and give back to the community, and just love every bit.
So then when the day finally came that you became one, what was that like? To go from 7, then high school yearbook, right? People write all kinds of things in high school yearbooks, but you're like, no. So hey, I said
Right.
when I was 7,
Yeah.
and then to go through your training and then to start actually working as a social worker. What was that like?
Well, I mean, my career has been fabulous. So I've been 18 years working. Started off working with children and youth, and I've worked in the acute care setting most of my career. And, the work has just been phenomenal in terms of the ability to work with teams, working with amazing other social work colleagues, but also other disciplines as well. And just being able to help people has been quite rewarding.
Kim?
Well, my story is totally different because I did not know what social work was, not formally. I do remember Kim Jordan, who's a social worker, had it in her yearbook, but it really didn't. Was years later when social work discovered me, or I discovered social work. I was working residence life where I, lived and worked for 16 years, and I really needed a different skill set. I had a Bachelor of Arts, but it wasn't providing me with the skills and knowledge I needed to deal with the diverse issues of people coming from other countries, to deal with all the social issues that students sometimes face, and adjustment issues and all of that. And so I did my social work degree to help me in my work. And I've never looked back.
What's the theme for this month? Because each year there's a theme, right? So what is it for this month?
Absolutely. So this year it's 7 points of unity, many possibilities. And this year, 2024, marks a new code of ethics. So the CASW, which is the Canadian Association of Social Workers, has unveiled this new code. And we're very excited about it because our last one was in 2005, I do believe. So this is a new beginning, if you will, in 2024.
That makes, obviously, right? When you have something like social work, you do, any profession really, but especially for social work, you would think when there's ethics involved, which there is, that every, decade and a half or more, or in this case, 2005, however many years that is, I'm not going to do math on the radio. It's time to look at this and see what has changed, what has evolved, where are we going, what are we as a profession, what are the ethics that still matter to us or that maybe need readjusting in terms of the language. So what has changed for this? What's been brought in?
For the Code of Ethics. Yeah. So one of the new values, if you will, is pursuing truth and reconciliation. So that's a wonderful new change and really highlights, the importance of social workers and the need for us to support truth and reconciliation, to learn and, and be as enveloped in the knowledge as we can to do that important work.
Yeah, I'm just looking. It's so pursuing truth and reconciliation, promoting social justice, respecting the dignity and worth of persons, valuing human relationships, preserving integrity in professional relationships, maintaining privacy and confidentiality. I can see that could be a little important, and providing competent and professional services. Right. So it's all stuff that would obviously make sense, but then it's interesting to hear like, hey, folks got together and said, hey, let's look at this and see, where it's evolved and what needs to change.
Yeah. So the other new value is valuing human relationships that wasn't specifically in there before, although human relationships is inherent in social work because no social worker is an island. We've all, work with colleagues, both social work and non-social work colleagues, and together we make, we really do that social work and do that helping together.
So what stands out here? Like when we go, when you're working in a profession, you have someone who's like a radio host reading out all like the ethical and guides and little bits and bobs there. What kind of comes to your mind about thinking of your profession and what you do?
Well, just to build on your point there, Kim, where you said no social worker is an island, and then speaking to the value of providing competent and professional services, and Bonnie brought in the working in multidisciplinary teams. We really do not work in silos. We really do rely upon all of our other professionals to build and provide those competent and professional services to individuals that are really specific and based on what those clients need.
Then Jill, let's go through your position then. And because I like these shows because when I've got social workers in or anyone from in this case, when it's healthcare and we have someone and you can figure out the web of everyone being connected and how it helps folks understand how it all works, right? So kind of run us through what you do now and then we can kind of create that web.
Sure. Okay. Yep. So the role that I'm currently in right now is with addiction services here in the Eastern Urban Region with NL Health Services. So addiction services provides, just as the name says, it provides counseling and group-based services for folks who are looking to make change in relation to an addiction. So whether that be a substance use addiction or gambling or behavioral addiction. So we provide what we would say like outpatient services. So we're based in the community. And in an office-type setting, so we work with individuals one-on-one or within a group-based setting.
Quite the time to be in this position.
Yeah.
What's that like, working through it and with all that you're doing?
No 2 days are the same, for sure. And that's what keeps it interesting. We have a really fabulous, strong team of addictions counselors that I work with. And, we work together to really provide programming that's responsive to what we're seeing in the community as it constantly evolves.
What's something you think people may not know about when it comes to that?
To the work that we do?
Yeah.
I would say right now, the most important point is that we don't have a wait list. Our services are available to people, and you just need to reach out, and we're here to help.
So who's this for then? For this, if there's no wait list, who are we speaking to then for
anybody
this help?
who's looking to make change in relation to addictive behavior.
And what's the range for addictive behavior?
Like age range?
Or no, just like when we talk about addictive behavior, what would the definition be?
Or
there?
anything that would be like if your substance use or gambling is problematic to you and in your life and you're wanting to make some change in relation to that, you can reach out.
And do you think some folks would be surprised about who might be reaching? Because it's everyone, right?
Oh, addiction does not discriminate.
Yeah.
We see all types of folks. We work with adults specifically. There's another child system that is outside of our current scope. So we work with all folks, all ages 18 and up, right from 18 to well into senior years. And it doesn't really matter. It doesn't matter how much money you bring in. It doesn't matter what job you have. It doesn't matter what your relationship status is. Everybody can potentially be wanting to make change with an addiction.
And when we talk about gambling, like what's the range for gambling in the province? Because for me, I'm aware of you go into certain spots, there might be VLTs. I know about folks who do sports betting. Like what else?
Yeah, there's also online gambling as well. So while we don't have, say, a casino here in our province, there is definitely VLTs, as you said, and online gambling. So those can all be very problematic. Even when you think about the pull tickets, scratch tickets, all that kind of stuff too. So sometimes that can become problematic and out of control for folks, and they're looking for some support and make change with that.
All right, Bonnie, how about yourself?
So most of my career, as I indicated, has been in acute care. And currently now I'm the Regional Social Work Coordinator for the Primary Healthcare Program with Newfoundland Health Services.
It's an exciting time to be doing this. There's a lot changing.
Pardon?
And there's a lot changing, right?
There's a lot changing.
There's a health
Absolutely.
accord,
Yeah.
and you're
Yeah.
you're part. So can you explain a bit about like with primary health and like I guess family care teams and what's going on?
Absolutely, yeah. So of course, the health accord is certainly driving a lot of our work in terms of healthcare transformation. So that's a 10-year plan for our province. So my work is really closely linked to that in terms of how do we transform the work that we do in primary care from a social work lens. So of course, Jill and I are actually working quite closely together from a mental health and addictions framework. So it's about building community partnerships. It's about providing access, better access to our patients and families in the province. So my work is quite rewarding. I work with all disciplines, and we have an amazing leadership team who allow for thinking outside the box and thinking about how do we work differently and improve access and enhance access for individuals and families in the province.
So if all gets pushed through and comes out the other end the way the design is, what will the reality be through a social work lens for folks, like as stuff gets up and running more and for like just what they'll be able to get?
Right. So, I mean, the health accord indicates that every single patient, every single person in the province will have access to a family care team, which means access to a social worker. So having that access, and I mean, we provide support to individuals from birth to death and for a variety of issues from whether it's, really focusing on, of course, the social determinants of health. So whether it's housing issues, whether it's income, whether it's supports. We know a lot of our seniors now are indicating they're lonely and isolated, and especially that's certainly come out from the pandemic. So how do we provide support and enhance the lives of our seniors as well? So that's quite significant.
So when it comes to enhancing lives of seniors, what is the work? Like, what is the social work involved there?
So a big piece would be providing an assessment, completing an assessment, I should say, and indicating, and really understanding what matters to the person, whether it's an exercise group they want to attend, or whether it's they need that phone call every so often. So it's really about making those connections with our community partners, whether it's with Seniors NL, whether it's with the Canadian Red Cross with their programs, our community supports program. So really about making those connections and navigating the individual through the system.
That's fascinating because I had a few weeks back the seniors advocate Susan Walsh was on, and we were talking about loneliness and isolation, right? And then when you talk about family care teams and from kids being born up until the seniors' age, and to have a social worker involved, but that loneliness bit is just that's where my mind is right now, just for that type of work.
Absolutely, and it's really about working more upstream. So the chronic disease management, but also the health promotion prevention. So how do we promote health, and how do we prevent? Prevent?
Because that's the whole thing. It's
Exactly.
like we're trying to flip everything. It's not. Let's not be reactive,
Yeah.
right? If we're helping people before there's an issue, then like maybe it will be better, right?
Right, absolutely. So a lot of navigation.
A lot, just a bit.
Yeah.
And so how are you? So then how will this work with you two working together? Because I'm just thinking if it's a community care team, obviously addictions. For every community care team, you'd have to have someone for that.
Exactly.
So would that be counseling?
Yes, so the addictions counselors who work with primary health care, and you can certainly jump in, Bonnie, will be doing addictions counseling with folks. And how Bonnie and I are collaborating is that I would provide that clinical consultation piece with them. So if they're looking to kind of consult on something or talk through a particular case, look for some direction, they can reach out to me for that. But then again, all the folks then are working on those primary health care teams.
Yeah, and in Newfoundland and Labrador, when I think addictions, right? So there's an opioid epidemic. There's alcohol. There's
Lots of stuff on the go.
Lots. There's no shortage of stuff on the go.
Yeah.
Let's go to the phone lines. Jessica Lyle is on the line, Director of Mental Health and Wellness and Healing with the New Natsiavut Government in Labrador. Hi, Jessica.
Hi.
How are you doing?
I'm doing well. Thank you for calling me in.
Oh, look, thanks for being on the list for this chat today. I love it when I get a whole list of social workers to talk to. How did you get into this, by the way? Why social work for you?
I really felt passionate about social work. I think similar to why a lot of other social workers get into social work. I think from the beginning of it, you feel a calling to it because of the type of work, and so it's so broad. But I think more personally about wanting to be an social worker, knowing the inequities Inuit face, and wanting to be a part of that change. There's a lot of things that we are wanting to take over for ourselves that is rooted in a cultural practice, that's rooted in cultural healing. And when we look at cultural ways of healing, they're innovative in the way that it's meeting our communities where they're at. And I think it's part of our overall achievement for self-determination and self-government that having our own social workers practicing from an Inuit-specific lens is also adding to that longevity goal of self-determination as well. So I think on a personal level, it felt political in that sense, but it also felt like a meaningful calling because you get to work at the community level, but also at the policy change level as well. And I think that's the beauty of social work, is that you can be working one-on-one at the individual level, but it also can morph into system change as well.
What types of system change have you seen so far as you've been working as a social worker?
I think it's been a part of a long-standing goal as well, in terms of there's been people who have done this work long before I have been part of it. I think social work is the type of thing that, although even if you're labeled as like a social worker, there are social work type things that we've been doing at community level as well. So I think of like the mental health and addictions work we have done, or the work around children in care or early childhood development, all those things we would think of as social work, that overall is something we've been trying to achieve. I don't know if that answers your question.
It does. No, it does. And I'm curious, when you started and as you kind of push through and you're doing this work and you're seeing change, what are you hearing from folks in the community, in Nunatsiavut, from work that Inuk social workers are doing?
I think when we have non-Inuit but also Inuit doing this work, it's rooted in a common goal of healing together. But it also takes the understanding that if you're not understanding what an Inuit-specific lens of social work looks like, being invited into that circle, but that also creates for the other person to understand an openness to learn that. I think the things we see most meaningful when families and communities are feeling that positive change is when they have a social worker or those working in the like-minded fields of somebody who felt open to what they need. We do have overrepresentation of Inuit children in care, and when we hear trying to have children connected to their communities, having them connected to their culture, it really takes a social worker and those around the table to have an Inuit-specific lens. And if you're not operating from that, to at least have the understanding that this is what an anti-racist practice looks like, this is what a meaningful practice looks like, and we're all here for a client to be healed better tomorrow. And that doesn't look like perfection, but it does take for us to understand that people come with intergenerational trauma, and they do come with their experiences. But it's our job to help them through that.
Well, it's obviously it also everything you're saying there touches on the code of ethics, the 7 values, and this update in it, and one of them being pursuing truth and reconciliation. How did you feel about the fact that that's there now, and that it is something that's baked into the ethics and the values of social work?
When we're thinking of that, I think it comes with accountability. And we always want, from the root to a foundation to be strong. When you're operating from a strong foundation, it also calls for accountability to be there as well. So while this is in the code of ethics, it also calls into question operating from that code of ethics too. So when you're a registered social worker, knowing that you're working towards truth and reconciliation and anti-racist framework, it really calls social workers to operate from that, to be familiar with that. And if you're unfamiliar with it, taking the ownership on yourself to operate from that lens so that we can have a better system that is for people.
While I have you, I'm curious your thoughts around mental health accessibility in the North and how it is now and what you would like to see it be like.
We would want for every opportunity that that is in the South or all across the province is what I should say. What is accessible in our province as a whole is what we would want to be accessible for everyone across the province, Newfoundland and Labrador, those in northern Labrador as well. Whatever is available there, we want available here as well. And we know that there are gaps across the board. I'm not disputing that there aren't gaps in more southern places in Newfoundland, Labrador. I think there is. But I think when we're talking about an equitable service too, and one based in equality, we want for what everyone is able to avail of for everyone to avail of, and that does make it Inuit specific as well.
Jessica Lyle, thank you so much for coming on the show today.
Thank you.
All right, that was Jessica Lyle, their Director of Mental Wellness and Healing with the Nunatsiavut government in Labrador. I'm Adam Walsh. This is The Signal. Today we're talking all about social work. It's our annual social work show, which we do each March to talk about Social Work Month. We've got a couple of folks we're calling. It's a cross-provincial show today. So here in studio with me, we've got social worker Kim Kelly, Jill Peckford, Clinical Lead of Addiction Services with NL Health Services in St. John's, and Bonnie Hobbs, Regional Social Work Coordinator of Primary Health Care and Chronic Disease Prevention and Management with NLHS in St. John's. But like I said, it's a cross-provincial show. We're touching on rural areas, we're touching on the north, and in and around St. John's Metro to get a full flavor of the profession. Thoughts on what you just heard?
Okay. Well, I'd like to say that, Jessica did a great job representing us, so thank you, Jessica. But one of the things, I guess, for me is I'm so proud to be part of a profession that actually requires continuing education. So in order for us to stay registered every year, we have to do that continuing education. And, of course, to help us keep up on pursuing truth and reconciliation. So there's webinars, to help us build that foundation that Jessica talked about.
Yeah, well, and also, I mean, when you talk about continuing education, there was a time when that was even on the radar to be talked about, right? So, like, this is the evolution of the society which we live in, and then to have a profession to say, hey, no, this is part of it. This is important for us, and there's reasons for this and for everything that was just laid out in the chat there. It's
a requirement, and we have a number of social workers who participate in that every year. They're from a diverse range of fields, and so we during Social Work Month, we have a number of webinars that are going to be presented by social workers here in Newfoundland provincially and nationally. And they're available on the NLCSW website for social workers, but also for the general public. So we have an accountability as well to make sure that the general public knows that we're keeping up on our knowledge and foundation. And they, too, can kind of look at what kind of things are we learning and keeping up on that continuing education about.
Any other thoughts? Bonnie, I was curious because you worked as well in oncology, right?
Mm-hmm. I did.
What was that like?
Well, it was 13 years working on the inpatient unit and quite a rewarding position, to say the least.
Why is it rewarding? Just run us through what that would be like as a social worker to do that job.
Yeah, so to work with a phenomenal team was one, but also to work with patients and their families, because from a patient and family-centered approach, at one of the toughest times in their lives. So being able to just have an impact, whether it doesn't have to be anything significant. A small impact really makes a huge difference for someone who's going through their cancer journey.
Yeah, and what is the role of a social worker when it comes to someone going through their cancer journey?
So counseling is a huge piece, but also, navigating patients and families throughout the system. You're dealing with patients and families from all across the province oftentimes. So really providing that, that support, whether it's at the bedside of a patient or whether it's, providing support to their families over the phone. It was quite a rewarding position.
I think as well, when it, like for everything everyone's been saying here so far today, I do think sometimes about stress and work and self-care. What, like, for either yourselves or teams you work with, how does that work for social workers? What is the discussion around? Because like I've done shows before about first responders and other folks in healthcare related fields. What's it like for social workers? Because it must be sometimes quite the, it can be a lot, I'm assuming.
Yeah, absolutely. Self-care is certainly a big part of, I think, being accountable to yourself and being accountable as a social worker as well. Yes, the work can be heavy. It can be quite stressful. It can be very much draining because you do give a lot of yourself to the work that you do. So, self-care, just to draw on that self part, it's very individual. It's different for every single person. So it's really about, learning and being a bit self-reflective about yourself and what's important to you as a person that can really kind of refill your cup. Yeah. And we talk about it a lot in our program, in the program that I work with. We really want to be our best self so that we can really provide that professional and competent service.
What's it like then also, like, look, we've got peer supporters here at work, right? So like and there's self-care, like you said, right? It's for the individual, but for just professionally talking and comparing notes with folks and checking in on each other, like how does that work and what's that like?
It's so important to talk with your colleagues because as things arise, as we all work on teams, it's really important to talk through those issues and kind of, and just talk about things and find, even among yourselves, that thing that works for yourselves, to find a little bit of humor sometimes in your lunchrooms or the break room over coffee. So important because self-care is more than just bubble baths, but it's really all about, finding exactly that individual piece that works for you, but also looking at your team and what's working well for every member of your team.
What do we think people may not get about, like, is there anything that needs demystifying for social work, do you find? Like when you meet people out in the community and you're like, oh, I'm a social worker. Is there a go-to thing or is there, how much explaining do you have to do about your professions?
Well, first of all, we're so diverse. So we're much more than working in child protection. That's the area sometimes that gets the most focus. And more recently, health, right? Because the bulk of our social workers do work in those two areas. But I mean, we have social workers even within healthcare and working in acute care. We have community social workers working in education like I did for over 20 years. Access and privacy, private practice, palliative care, recreation, rehabilitation, research. And a lot of my own social work practice has been advancing policy with regards to social work education and academic education in general. So many different areas that we look at. Social workers work in research, work with military families and veterans, work with new Canadians, HIV and AIDS, homelessness, as Jill talked about. So just so many other areas that don't always get, talked about sometimes.
Well, yeah, exactly. That's what I was getting at, right? Because like especially when I was growing up in the 80s, there would be certain thoughts around social work. So have you found that's waning? Like, is it disappearing or what do you think?
I think it is disappearing a little bit. I would hope. How about that? I hope it's disappearing a little bit.
Yeah.
I think that the more, as social workers, we can really talk about the diversity of our practice, that will obviously demystify it more.
Yeah.
Yeah.
I was always surprised with the counseling side, right? Because it was something like I'm doing a job as a reporter, then moving into radio hosting and started doing these shows. I was like, oh, well, yes, that would make sense why I've run into a couple of social workers and told me they're counselors. Like it wasn't something that kind of, my mind didn't click on it right away.
Yeah, and I often say, like, I do clinical counseling. That's my role, but my background is social work. Yeah. I'm still very much a proud social worker at heart.
Yeah, right on.
And there's over 1,800 of us in Newfoundland and Labrador, so we're the second largest allied health profession in the province. A lot of people might not know that about us, and we're growing every year.
So then, for folks who are thinking about going into social work, what would your messages be to them? Like, is it, yes, go right in, it's great, like, you can have a great career and like everything you thought before is like, came through? Is there warning around it? Like, what do you think?
I would definitely encourage anyone who's interested in social work to pursue that. I think what changed for me from when I thought I would do social work till I actually got out was when I was at university, I really thought I wanted to work in a certain area. But then when I actually finished and started getting exposure and getting to learn about all the different areas you could work, I was like, oh my goodness, I'm actually really interested in this. I had no idea I would really enjoy working with mental health and addictions.
Yeah.
So, I guess just not to think you're going to maybe work your whole career just in a certain area. There's lots of opportunities to do different things.
Yourself?
Yeah, I would, 100% encourage it. And just to echo what Jill has indicated, you can work in so many different areas. I've always loved what I've done since I've graduated. And I think, you have to love your work. You have to be really passionate about your work in this field. And so for anyone interested or wanting to pursue it, I would, 100% encourage it.
And I asked this earlier, but just to get for yourself, Bonnie, like the passion bit. What happens if you're not passionate in this? I guess you just can't be effective, right?
Right. And if you're not passionate, then maybe it's moving on to a different area.
Yeah.
So maybe it's
exactly.
that particular area. But yes, absolutely. I think being passionate and really loving what you do, it shines through in your work.
Mm-hmm.
What's it like? You're always connecting with people, right?
Mm-hmm.
So what's that like? What is that like for you? Like for me, every day I meet new people on the air. I talk to them for a bit, but like it's not. I don't know. As a social worker, there's a much deeper connection from the little bit I know about the profession. So, what do each of you get from those connections that you have with folks?
For me, it's if you can have a small impact every single day. If you can have an impact on someone every single day, then I think that's quite significant.
And it's just really rewarding to see working with individuals and seeing them meet the goals that they set for themselves.
Yeah.
And knowing that you could walk alongside them to meet those goals, there's no better feeling.
Because often when I've done shows on addictions, right, people say, well, it's not a straight line, and everyone's goals are different. So then
Exactly.
if you're there with them just for those goals, right? Like there might be a bigger overall one, but it's like, no, this was a weekly one or a monthly or whatever. It
could be daily.
that can be huge, I would imagine.
Yeah. So just being afforded the privilege to be inside someone's personal life like that and to have that trust and respect and to be able to walk alongside them to meet those goals, it is quite a very fortunate place to be.
And that's an interesting bar for success, right? Because you can have a big ambitious bars sometimes for success, but if you're with someone, it's like they made Tuesday's goal.
Yeah.
That can be huge.
Yeah. For sure. And it's really about supporting their own autonomy in that. Yeah. It's not about my goal that I may have for someone. Right. It's really about their goal.
Yeah. So you've got your own hopes or whatever, but
absolutely.
So I guess it's tied into the plan that the person comes in. You're just there to help facilitate the plan.
Exactly.
And empower.
And empower them.
Exactly.
And support them and make sure that they're able to have all the skills and knowledge that they need to get to that place.
So when we say for empowering, what are some things for the work you've done that you've seen and helped folks be empowered to do? Like just kind of to get a describer on it.
Okay. So for me, a lot of what I've done when I was working in the area of career development was helping people with their resumes, helping prepare for interviews, helping prepare for scholarship applications, for graduate programs. So really helping them toward their goals of success. Now, success looks different for everybody, but working with the individual on their plan. And, for me as well, in my years of working at Memorial, got a chance to help students develop their leadership skills. So that's a different type of social work than most people would think about, but really an honor to be part of their journey on the road to success.
Yeah, and watching people get better with leadership and then what that can bring them in life.
Absolutely. Today's, even right now, currently Memorial students or college students, are our future. So it's really important to develop that foundational knowledge and help them navigate their way through academia.
Any other thoughts on steps and helping people move on?
I guess really looking at, from a social justice lens as well.
Okay,
and, taking in the whole social determinants of health too, right? So if we really look at if people are feeling marginalized or the populations that are more vulnerable, really kind of working with them from that perspective to really empower them to live to their best potential.
Yeah, no, exactly. This is The Signal. I'm Adam Walsh. We're talking about social work today, Social Work Month. And on the phone right now, we've got Natalie Hopkins-Andrews, Community Supports Program, White Bay Central Health Center. How you doing?
I'm doing well, thank you.
Thanks for coming on the show. So the same question that I asked the rest of everyone else. Why did you get into social work?
Well, I guess not hearing what the other individuals. As said, I guess my reason would be, to help people. Bottom line is, make a difference in someone's life and help them achieve the goals that they, either set for themselves or work with families to help them achieve those goals. With working with the disabled population, obviously some, individuals aren't able to identify their own goals, for whatever reason, whether it be because they're not even able to speak, but, you work with the family or, caregivers to help them achieve their goals.
Tell us a bit more about just what you're doing with community supports for White Bay Central Health Center.
Well, my primary focus is children and adults with intellectual and physical disabilities, and those are the individuals who manifest, have difficulties before onset age of birth, before age of 18. I also work with seniors and individuals whose limitations result from, accidents or illnesses. So it could be providing application, doing assessments for home supports, connecting them with other agencies, whether it be income support, could be medical transportation, could be even housing or Newfoundland Labrador prescription drug program. So there's a whole host of things that, I do as a case manager for community support.
You're from the area too, right?
Yes, actually, I grew up in Ingley, so
Okay, right on.
I'm really close to home.
So what's that like? You growing up in Ingley, staying close to home. You wanted to help people, and you're staying in your community or the area, and to be doing the work you're doing. How's that going these years later?
But it has its advantages and disadvantages. Being from a rural area. Obviously, people just by the very nature of the fact that you live here and you grew up here. So that can work to your advantage, certainly, when you're trying to approach them. You already have, that foundation. So in terms of them being comfortable with you, you do have somewhat of an advantage that way. And, of course, then there could be disadvantages, too, because you have to establish, boundaries when it comes to working with individuals and having your own time and not, encroaching upon that when you're actually not working.
Oh, yeah. When you got a bunch of folks on a first-name basis, yeah, it's great for knowing their first name and talking to them. But then on the other side, it's Sunday evening and your phone's ringing. You're like, no, tomorrow's the work day, not today.
Exactly.
I'm just speculating here. Not that. What about the difference between we often talk about the rural-urban divide, right? And we talk we talk about resources. Earlier I was asking Jessica Lyle, the director of mental wellness healing with Nunatsiavut government in Labrador, just about mental wellness in the north. And Jessica mentioned, it'd be great to see the same types of resources across the board, whether you're in the north or you're in rural Newfoundland and Labrador, or you're in the St. John's metro area. What are your thoughts just on some of the divide that you see professionally?
Well, from a professional perspective, living in rural Newfoundland certainly puts you at a disadvantage when it comes to resources. Even when you think about things like, public transportation, it doesn't exist here. Yeah. We don't have services like Meals on Wheels, for seniors, especially who are, impoverished or living in their own home and don't have, a lot of resources that way. Even activities like for seniors and persons with disabilities, there's that gap. One of the big things in our area, of course, is the shortage of home support workers. We don't have agencies that we can just call up and say, we have this individual has X number of hours. Do you have a worker available? It's been a real struggle in the last few years, and certainly now, with finding home support workers. And then, of course, limited housing options when it comes to even facilities or long-term care facilities and personal care homes, because we have, of course, with the senior population on the Northern Peninsula, is probably the largest population base. And at the end of the day, if you can't support individuals to stay at home because they don't have workers, then where do they go?
How does that impact the work you're doing then?
It makes it very challenging, to say the least. Yeah, you try certainly everything you can to support individuals to stay at home, but at the end of the day, if it's not safe for them to do so, you have to explore other options, which aren't always readily available, unfortunately.
And with you identified a bunch of lacking stuff, right? Like from resources and everything else. So, and I asked about the impact, but what does this mean for your own planning for just the job you're doing, and then trying to plan for the future when you just keep looking around? You're like, well, we don't have enough home care workers. Folks can't stay in their homes, but we also don't have places for folks to go afterwards. And like everything seems to be a barrier, a blockade, and in some cases a dead end. So how do you kind of plan through that, or do you?
We do the best we can. Yeah. I mean, we bring it to the powers that be, I guess, the government and the upper officials are aware of the issues, and I guess we're trying to work collaboratively to find solutions to those. But it is challenging for sure.
Yeah, challenging. Is it? Do you still have the passion for the job as you work through this? Or this is something we've talked about through the show. The fact that social work, you need to have passion to continue to do your job. How do you feel about it day to day with those types of challenges?
Sometimes it can be disheartening. I'm not going to lie, but you wake up and it's a new day, and you face each day with renewed vigor. And I did hear, like one of the other ladies say, if you reach the point where you no longer have passion for the job, then it's time to, I guess, look elsewhere and determine what else where else you want to work or whatnot. But absolutely.
Excellent. Natalie, thank you so much.
Thank you very much.
Natalie Hopkins-Andrews there, Community Supports Program, White Bay Central Health Center. Thoughts on what Natalie had to say? I mean, there's a lot there, like that urban-rural divide and just knowing about the resources that colleagues are facing, or the lack of resources into doing their jobs.
So I guess one of the important things would be as well to not only do we have to develop relationships, but we also have to know who's providing the services. Yeah. So it's really important for us when you're in a rural area, or even when you're in St. John's, and we're so big, right? And there's so many services even within a place like Newfoundland Health Services. We really have to rely on our colleagues to find out like who's providing what, where, and when, and how can those collective services, how can we either collaborate or drop on other resources to kind of, meet the needs of the people that we're working with.
Mm-hmm. And I think one of the things that perhaps, if I could go out on a limb to say that the social work profession learned through the pandemic is the ability to really shift our services to the whole virtual world.
Totally.
So that has really, I think, opened up the possibility to kind of offer increased services to those really rural and remote areas. While it's probably not ideal, and we would prefer, maybe more face-to-face personalized service, even having the ability to offer, say, for example, clinical counseling or group work through a virtual service is now, it's happening.
Yeah. It's so interesting that it took for a bunch of reasons, right? So,
yeah.
But like for the pandemic, it's like, oh, we can actually, there's some stuff that can be done here, which like for the reality of Newfoundland and Labrador, in that case, I'm being very specific here because there's a bunch of outlying issues, but that can be really beneficial.
Mm-hmm, for sure. And I think that's just one area that the social workers and social work practice has really, shifted and pivoted to kind of, provide better service.
And changes over the years for social work since you've been in. What do you think about where it's headed, like what you've seen for the evolution of social work since you've been in and where it's headed?
The sky's the limit.
Okay.
Right? Because there's really, because we're becoming so diverse and social workers are working in so many different areas and doing different things, that there's really opportunities that exist. And for social workers, sometimes when we're in, a rural place, or when we're even in the virtual world, when we don't see a service that meets the need, it's up to us sometimes to create those services and to work with those to do that. So the opportunities are just endless. So I would say to someone choosing social work that, if you're passionate, you want to be creative sometimes, you want to be, all of those things that, social work is the place for you, that you can really, there's the career here and there's no straight line, right? We're all about navigating through the circles and the squares and, all of those, right? To navigate where we are.
Any other thoughts on that?
I think, looking at the evolution, say over my career, is that really social workers being seen as an essential part of the healthcare team or essential part of the community.
Yeah.
Yeah.
Yeah, just seeing that change, right? And people start to understand.
Mm-hmm. Yeah.
Bonnie, yourself?
Yeah, no, I think, the piece that Kim alluded to in terms of the community partnerships and the navigation and the importance of that role. And I think that's certainly where we are in primary healthcare right now. I think that piece is quite significant in terms of where we are.
Yeah, and just figuring out so much of life too, right? It's figuring out like who is where, what can they do, and if I know about that, that can help with the thing I'm trying to do and the people I'm trying to help, right?
And I guess one of the things in going forward for us, we are a regulated profession for over 30 years in Newfoundland and Labrador. I mean, when you think about our history, that's so important. So there's going to be an event at the Rooms that's being facilitated by Donna Hardy-Cox and Michelle Sullivan, and they're profiling the history of social work and social work education in Newfoundland and Labrador. And that's so exciting because we didn't have a place to examine and to kind of review and reflect upon our history, and we have such an important one in this province.
Yeah, history and legacy, right? So you look at all those years, all the folks who are working in it and where things are now, and then the new crop coming in and what that's going to be.
Yeah, I mean, when we look at Jill's story and Jill being, having people in her family who had social work backgrounds, right? So carrying on that through the families. I mean, that's the future of social work, but yet you don't have to be from a family from social work to be a social worker, right? So you can really come. My own background, I'm from the Southern Shore, and I was influenced by my dad who was, involved in the community and social justice. And then through Sister Lois Green, who was a great mentor to me through chaplaincy when I was a student, and the Presentation Sisters, and how I learned from there. So, there's so many different roads that we can take and so many different paths to follow.
Jill, what did the family think when you got into it back then?
I think they thought it was just going to be a natural fit.
Yeah.
And here I am.
There you go.
Yeah, for sure. Yeah.
Any final thoughts? We're done. So anything to leave us with for social workers? One final message?
That we, that we guide ethical practice, inclusive and empowering social work practice, and that, we're in this together, and that we hope to improve lives and make a difference in our community one step at a time, right? Together with the people that we're working with. And, that's a great place to be.
All right, Kim Kelly, Jill Peckford, Bonnie Hobbs, thank you all for coming in. That is it for today's show, and I'm going to be really clear for everyone for tomorrow, so I want everyone listening out there. This is a surprise. I know you're thinking, like, could there possibly be a gardening show on a Tuesday this early in the year? And my answer is, of course, there's a gardening show. It's preseason gardening. Tim Walsh is going to be here tomorrow because we have to set up everything for the regular season of gardening, because if there's baseball being played in Florida, we can be talking about gardening here on The Signal with Tim Walsh. So gardeners, get your grow questions ready for tomorrow. Taking us out, PEI's Jen Grant is nominated for Song of the Year at the East Coast Music Awards for her song Judy that she performs with Kim Harris. Here it is.
She was a payroll honey, wanted a blonde beehive for her wedding day, 'cause you might as well try. He drove a Cadillac and a cherry red, had his hair slicked back, but there was something to be said for Judy. Give me a reason, Judy. Something to believe in under the disco ball, holding silver shoes from her tired feet, but she was feeling brand new. And a baby waits, only 10 weeks old, and they drove all night. A new mother's gonna hold her. Judy, give me a reason. Judy, something to believe in. Judy, something to believe in. Give me a reason today, something to believe.